Okay, so again, it's again minimally invasive endoscope assisted temporalis fascia graft harvesting technique. So as you all know, the temporalis fascia is a thick appendicitic sheet that grooves over the temporalis fossa and covers the temporalis muscle. So it's an excellent graft which has a more tensile strength and it has a minimal donor side mobility. So these are the indications where you can use the temporalis fascia. It's like a facial reconstruction. Again, the rhinoplasty, what we're using for the augmentation, any irregularities and camouflage. So again, the ENT procedures like tympanoplasty, and also you can use in the facial nerve reanimation. So this is a small video of graft harvesting technique, how I do in regular basis. So did you guys have that? So first of all, I just mark the superior line. So I just tell the patients to bite so that you can take. So then after that, just we remove the hair follicle, and we don't cut the hair follicle, and we, as much as we can preserve the hair follicle. That this is my marking. This is a normal marking for normal temporalis fascia harvest, and this is the 2 incision, which where we can give a 2 incision the anterior and the posterior medial and lateral. So after that, we have given the tenuation agent, and this is a 2 incision. It's like that facial lata harvest technique, which with the minimal 2 or 3 incision you can harvest the how much we require the facial lata. So this is the same technique. This is a small incision. We give the incision in a like a bevel incision, like 45-degree angulation, so that any hair follicle, if it is there, so it will not damage the hair follicle, and the hair follicle can grow along with the scar line. So there won't be scar after the healing of this incision. So this is once we dissect the skin and superficial fascia. Now this is your superficial fascia, where all the main structures are there, like superficial temporal vessels and artery. So once we go, then again we see a white structure, which is the deep fascia. Again we retract. And you go deep. This is all a blunt dissection, so that will not injure any important structures. So once we get the layer, so we are in a safe zone. Now here is the deep fascia. Once you get it, the same. The incision will give in the next. Okay. Again the same incision, the 2 incision. Medially again the same plane will go. We'll just give a bevel incision so that our hair follicle will preserve. Once we go, we same with the blunt dissections, we go into the deep fascia. So now the deep fascia we have like exposed. So once we expose the both sides, so in a fanning motion, we just run the periosteal elevator. So release the requirement of the fascia. Once we do it, then we take an endoscope to see and give the markings. So in the direct visions, we mark the lateral side and the medial side in direct visions, and with the other borders, we just mark with the endoscope assisted. This is a 2.5 centimeter width, and the length is the 4.5 centimeter of temporalis fascia. Now you see the marking in the endoscope in the same incision. Yeah, now we go through the same incision. See the markings with the endoscope. Once markings are done, we give a hydrodissection tuition anesthesia. Along with it will help in the vasoconstriction where the muscle is below the fascia. In the direct vision, we just give the medial and lateral cut, and after that, the side borders. Just help with the endoscope. Now the endoscope is inserted and we can see the markings, and with the endoscope, with the help of the endoscope, we just cut the fascia. We give a small incision from the anterior to the posterior border. This is my knife, and you can see the cut. This is how we cut the fascia. This is how we harvested the fascia with the minimal invasive, like a small incision. If you need more fascia, then you can also give a one more incision more posteriorly, and you can harvest it. So these are the complications: the postoperative pain, alopecia, graft shrinkage, injury to fascia, because and hematomas, infections, and flap necrosis. The postoperative care are wound care and avoid any heavy chewing for some 2 weeks, and be fine. These are the conclusion, like temporalis fascia is versatile graft, anatomy is very important, and it is a traumatic harvesting tool, graft survival, and hospital.